And the chair recognizes himself for 5 minutes for an opening statement. Today, we're here to examine the SUPPORT Act and how its implementation has helped increase access to prevention, treatment, and recovery services. Since the passage of the SUPPORT Act, there have been several efforts to address issues related to substance use disorder and drug overdoses, which include Restoring Hope for Mental Health and Well-Being Act and the Halt Fentanyl Act. This hearing will give us the opportunity to see what legislation solutions have been working and address any potential gaps. Earlier this month, we convened a field hearing in Gettysburg, Pennsylvania, where we had the opportunity to hear from addiction experts to learn about how policies from the SUPPORT Act have helped in the fight against drug overdoses. We heard heart-wrenching testimony from Michael Straley, who lost his daughter Leah on Valentine's Day a few years ago to fentanyl poisoning. Tragically, there are hundreds of thousands of stories like Michael's. In just the past 2 years, more than 200,000 Americans have tragically lost their lives to drug overdoses, driven by synthetic opioids such as illicit fentanyl. In Kentucky, over 70% of all drug overdoses are caused by illicit fentanyl. The evidence is clear that we have more work to do to effectively curb historically high drug overdose rates, and it's more important than ever that this committee recommit to addressing this crisis. Key to ensuring success will be a focus on prevention efforts. One example of legislation we are considering today would address the threat of xylazine or a tranquilizer routinely used for animals that is quickly becoming one of the deadliest street drugs. H.R. 1839, the Combat Illicit Xylazine Act, led by Representative Pfluger, would subject individuals who distribute these substances illegally to Schedule III penalties. To supplement this work, we are considering legislation to allow federal funding to be used for fentanyl and xylazine testing strips in states where they are legal and to help ensure that all FDA-approved overdose reversal medications. Prevention, however, must be coupled with policies that promote access to care to help those who are currently struggling with addiction. That's why we're considering legislation today that will provide access to reliable care for vulnerable populations, including providing for medication-assisted treatment for Medicaid patients and treatment services for foster care youth and for pregnant or postpartum women. Of note, H.R. 3892, the Improving Mental Health and Drug Treatment Act, will lift the IMD exclusion for residential and inpatient services. The exclusion, which arbitrarily limits access to residential care facilities with 16 or fewer beds, has been a significant barrier to care for vulnerable populations, including homeless populations and children that are currently being boarded and treated in emergency departments for several mental illness and substance use disorder, rather than able to get care in a clinically appropriate setting. The legislation will ensure patients are receiving the most appropriate and comprehensive care to address their needs. Thank you to Dr. Burgess for your historic leadership on this important issue, and I look forward to moving this bill forward. We're also examining solutions that will promote long-term recovery and wraparound services to support individuals' journey to rehabilitate their lives. This includes my bill, H.R. 1502, the Comprehensive Opioid Recovery Centers Reauthorization Act, which reauthorizes the Comprehensive Opioid Recovery Centers program for 5 years. The CORCS program is responsible for providing wraparound treatment and recovery support services, including workforce training, to individuals living in communities with disproportionately drug overdose rates. I am proud of the early results of this program, and I'd like to thank Representatives Tonko, Bouchon, and Peters for their partnership on this issue. Before I close, I would like to touch on bills before us that would attempt to support the behavioral health needs of those moving in and out of the criminal justice system. There is more we need to do to address access to the care for these individuals so they can get the right care as they re-enter the communities. We're looking at 2 proposals before us today in their current form. We need to make sure we don't do massive cost shifting from state spending to federal spending without first solving the problems at hand. So we need to look carefully at the 2 bills before us today that do that. I look forward to identifying long-term solutions that are fiscally responsible and empower states to provide access for care to incarcerated individuals. I look forward to continuing the process to reauthorize SUPPORT Act, and I thank my colleagues for leading on these bipartisan policies. And I yield back and will recognize